going to be your nurse practitioner today. It's nice to meet you. Your name's Julia?
Yes.
And you and your mom signed a consent that it was okay for me to assess you today?
Yes.
So can I go ahead and get started with the head to toe assessment?
Yes.
Okay, first I'm going to wash my hands. I'm going to look at your head. Skin. Your temperature of your skin is warm, dry, intact. I see a few moles. Do you have any other kind of openings that you know of in your skin? I saw in your history that you had multiple surgeries on your ear, on your left ear. Do you know if you're allergic to any medication? Is there any other things wrong in your history that you know of? Okay. Go ahead and get started, okay? First we're going to check your cranial nerves. Can you wrinkle up your forehead for me? Okay. Can you close your eyes real tight? Open them real wide. Okay, blow out your cheeks. Okay, clench your teeth. Clench them real tight. Okay, I'm going to check your temporal lobes. Okay, now open your mouth. Move your jaw side to side. Okay, now clench your teeth together again. Now try to open your mouth. Okay. Any pain when you do that? Check your sinuses. And so do you had a recent ear infection and sinus infection like a month ago? Are you having any pain there when I touch? No? Okay. We did a test on your vision. It was called a Snelling's test, and you got 20/20 for both eyes, so your vision is good, and that means that you don't have to have any glasses at this time, okay? I want you to cover up one of your eyes. Okay. Now I want you to look straight at me and tell me when you see my finger, okay? Okay, other eye. Okay. Now look with both eyes. Okay. Now touch your nose. Touch my finger. Touch your nose. Touch my finger. The other hand. Touch your nose. Touch my finger. Touch your nose. Touch your finger. Okay. Now I'm going to look inside your eyes. That's good. Okay. Now look at your pupillary light. Brisk. Equal. 4 millimeters brisk and equal and accommodating to light. I'm going to look in your nose. I'll look at your ears first. Okay. Any pain? Turn your head. Oh, a little thing came up. Okay. Look at the other side. That was the side that there was a lot of scar tissue, and this side is pearly gray. Look in your nose. I'll just use this little light. Okay. I'm going to put one finger over that. One finger. It looks patent. There's no drainage. Clear. No redness. Okay. I'm going to look in your mouth. Say ah. Stick your tongue out for me. Okay. Moist, no foul odor of your breath. At this time, I would stick a tongue blade at the back of your throat and check your gag reflex, and you would have a positive gag reflex, okay? Now I'm going to check your neck. Check your carotid artery. can you tuck your chin for me all the way? Now do your head all the way back. Okay, back down, back in front. Okay, turn your head side to side. Okay, now I want you to do it against my hand, the other way. Okay, now shrug your shoulders for me. Okay, doing it one more time. Okay, any pain? No? Okay. I'm gonna have you lift your arms up, like to the side like that. Push, not push down. Good job. Okay. Now I'm gonna have you turn around. I'm gonna look at your back. Okay, now cross your arms for me. Okay, I'm gonna percuss your back. And look at your spinal. Any tenderness? Okay. You can sit up and relax. Okay. Deep breath. Okay. Now I'm gonna while I'm back here, I'm gonna look at your thyroid. Swallow for me. Okay. So I'm gonna have you turn back around for me. So I can look at how you're breathing. Deep breath. So your breathing is regular and you're not using any abdominal muscles. That would have been best more with you laying down. Listen to your lungs. Deep breath. Okay, just lean forward for me a little bit. Deep breath. Okay. Now look at your hands. Reflex your turgor. That's good. Let me look at this hand. Turgor is good. Check your pulses. Your pulse. Your lymph nodes. Check your brain. Your brachial pulse. Your lymph nodes. And second hand. Can you grab my hands? Pull me towards you. Push me away. Grip my hands real tight. Okay. And so I'm going to have you do your fingers out, back in. Okay. Push down on my hands. Okay. Pull your fingers up. There you go. Good job. So I'm going to now check your heart sounds, okay? First I'm going to listen with the diaphragm. seconds. Okay, I'm gonna flip it and listen again. I want you to lean kind of to your left side. So normal heart sounds, no murmurs, no irregularities. So now we're gonna listen. Now we're gonna look at your stomach. So if you want to lay down where you're comfortable. Okay. Abdominal sounds are normal, and you don't have any heart murmur or breathe that I can hear from there. I'm going to palpate your stomach, okay? Okay. Now I'm going to press. Any pain? No pain? Okay. So now while I have you down here, I'm going to look at your legs, okay? Can you lift your legs up? Both of them up off the bed. One at a time. Hold that one up. Okay. Hold that one up. Okay. Bend your knee. Okay, let's lay your leg out. And then back down. Bend your knee. Okay. Now I'm going to check your pulses. Bend your knee. And your feet. First I'll do these. Pull your toes up. There you go. Push down like you're pushing on a gas pedal. And straight here. Okay. Now I'm gonna sit you up and check your sensation. Okay. Can you sit all the way up for me? This is just a soft object, so I'm gonna have you close your eyes and you tell me right or left and what part of your body that I'm touching, okay?
Left, my forehead. Right, my cheek. Right, my leg. Left, my leg. Left, my cheek.
Is it any different on either sides of your face?
No.
What about your legs?
No.
No? Okay, can you tell me what this object is right here?
Stethoscope.
Okay. What about this?
Pineapple.
What is this?
Plate.
Do you know what year of it is?
2017.
Who's the president?
Donald Trump.
Do you know what month it is?
September.
Okay. Let me get my sharp and my dull objects. So I have one thing that's sharp and one thing that's dull, okay? And this, let me show you in your hand. This is my dull object. This is my sharp object. You tell me if it's sharp or dull, okay? You can close your eyes again.
Dull. Sharp. Dull. Dull. Sharp.
check your reflexes, okay? It might make you kind of jump a little bit. So. Okay. I'm going to have you stand up and close your eyes, okay? This is called the Romberg's test to see if you're dizzy, how you're standing. Okay, you can open your eyes. Now walk towards me. Okay. Now you need to walk one foot in front of the other foot, all the way back. Okay. Now walk on your toes towards me. Toes. Now do your heels. Heels, good job. So now I need you to come towards me and turn around. Now bend down and touch your toes. Okay. Now stand all the way back up. Okay, lean side to side. Okay, twist. Can you twist your body? Okay, side to side, good job. Okay, that completes our assessment. Thank you for letting me assess you. You had a normal assessment.